Are you tired of that constant nagging pain in your knees? Does climbing stairs feel like conquering Mount Everest? Do you find yourself avoiding activities you once loved just because your knees won't cooperate? Well, you're not alone. Millions of people around the world wake up every single day dealing with knee pain. And today, I'm going to share everything you need to know to finally get relief. Before we dive in, let me tell you something important. What you're about to learn in this video could literally change your life. I'm not exaggerating. By the end of this, you'll understand exactly why your knees hurt, what mistakes you're making right now that are making it worse, and most importantly, the exact steps you need to take to start feeling better. So stick with me till the end because the last tip I'm going to share is a game changer that most doctors don't even tell their patients about. Now, let's get real for a second. Knee pain isn't just about physical discomfort. It affects everything. Your mood, your productivity, your relationships, even your sleep. I've seen people miss out on playing with their kids, skip family gatherings, and give up on their fitness goals all because of knee pain. And the worst part? Most people just accept it as a part of life. They pop a painkiller and move on, never addressing the root cause. But not anymore. Not after today. So what exactly causes knee pain? Well, your knee is one of the most complex joints in your entire body. Think about it. This joint bears almost your entire body weight every single day. When you walk, your knees take on 1.5 times your body weight. When you climb stairs, it's 3 to 4 times. And when you run or jump, we're talking about 5 to 8 times your body weight. That's insane when you think about it. Your knee joint is made up of bones, cartilage, ligaments, tendons, and fluid. All these components work together like a well-oiled machine. But when even one part of the system gets damaged or inflamed, that's when the trouble starts. The cartilage, which acts like a cushion between your bones, can wear down over time. The ligaments that hold everything together can get stretched or torn. The tendons connecting your muscles to your bones can become inflamed, and the fluid that lubricates your joint can decrease or become less effective. Understanding these components is the first step towards finding lasting relief for your knee pain. Now, let's break down the most common causes of knee pain. You might recognize yourself in one of these scenarios. First up, osteoarthritis. This is wear and tear arthritis where the cartilage in your knee gradually wears away. It's common in people over 50, but due to modern lifestyles, we're now seeing it in people in their 30s and 40s too. Then there's patellofemoral pain syndrome, also known as runner's knee. It's that pain around or behind your kneecap. This happens when the kneecap doesn't glide smoothly, possibly due to muscle imbalance or overuse. Ligament injuries are another major cause. You've probably heard of ACL tears, especially if you follow sports. The ACL stabilizes your knee. When it tears, usually from sudden stops or changes in direction, the pain is immediate and intense. Meniscus tears are incredibly common too. The meniscus is a C-shaped piece of cartilage that acts as a shock absorber. When you twist your knee awkwardly, especially while bearing weight, you can tear this cartilage. Tendinitis is another culprit. This is inflammation of the tendons around your knee. Patellar tendinitis, or jumper's knee, affects the tendon connecting your kneecap to your shin bone. It's common in people who do a lot of jumping or running, with pain usually right below your kneecap. Bursitis shouldn't be overlooked either. You have small fluid-filled sacs called bursae around your knee joint that reduce friction. When these get inflamed from repeated kneeling, a direct blow to the knee, or bacterial infection, you get bursitis. The knee becomes swollen, warm to touch, and painful. Here's something many people don't realize. Your knee pain might not even be coming from your knee. Problems in your hips, ankles, or lower back can cause compensatory movements. If your hips are weak or tight, your knees have to work harder to stabilize your body. If your ankles don't move properly, your knees take the brunt of the impact. And then there's the elephant in the room that nobody wants to talk about: weight. Every extra pound you carry adds about 4 pounds of pressure on your knees. Your lifestyle choices play a massive role too. If you sit at a desk all day, your hip flexors get tight and your glutes get weak. This creates something called anterior pelvic tilt, which changes the way forces are distributed through your knees. If you wear high heels regularly, you're increasing pressure on the kneecap. Now, let me tell you about the mistakes people make when dealing with knee pain because this is crucial. The biggest mistake? Complete rest. While you shouldn't push through severe pain, complete inactivity actually makes things worse. Your muscles get weaker, your joint gets stiffer, and you're more prone to injury. Another huge mistake is relying solely on painkillers. Look, I'm not saying never take pain medication. But if you're just masking the pain without addressing the underlying problem, you're not fixing anything. Plus, long-term use of NSAIDs like ibuprofen can have serious side effects on your stomach, kidneys, and heart. Use them when you need to, but don't make them your only strategy. People also make the mistake of jumping into intense exercise too quickly. Maybe you've been sedentary for months or years, your knees are hurting, and you decide to suddenly start running 5 miles a day or doing heavy squats at the gym. That's a recipe for disaster. You need to build up gradually, strengthen the supporting muscles, and improve your movement patterns before you go hard. Ignoring proper footwear is another common error. If you're wearing worn-out shoes with no support, or shoes that don't fit your foot type, you're setting yourself up for knee problems. Your feet are your foundation. When they don't work properly, everything up the chain suffers, including your knees. And here's a big one that drives me crazy. People skip the warm-up and cool down. You cannot, I repeat, cannot just jump into exercise with cold muscles and expect your knees to be happy about it. You need to warm up to increase blood flow, improve flexibility, and prepare your joints for movement. And you need to cool down to help your body recover properly. Now let's talk about what you should actually be doing to get relief from knee pain. This is where things get really interesting because I'm going to give you a complete action plan that you can start implementing today. And trust me, if you follow these steps consistently, you're going to see results. First things first, let's talk about the RICE method. This is your go-to for acute knee pain or immediately after an injury. RICE stands for rest, ice, compression, and elevation. Now, when I say rest, I don't mean become a couch potato. I mean avoid activities that make the pain worse. If running hurts, don't run. But you can still do gentle movements and activities that don't aggravate your knee. Ice is incredibly powerful for reducing inflammation and numbing pain. Apply an ice pack for 15 to 20 minutes at a time, several times a day, especially in the first 48 to 72 hours after injury or during a flare-up. Compression with an elastic bandage can help reduce swelling, just make sure it's not too tight, and elevation means keeping your leg raised above your heart level when you're resting, which helps fluid drain away from the knee. But here's where most people stop, and that's a huge mistake. RICE is just the beginning. If you really want to heal and prevent future problems, you need to focus on strengthening the muscles around your knee. Your quadriceps, the muscles on the front of your thigh, are absolutely critical. These muscles control how your kneecap moves and absorb shock when you walk or run. When your quads are weak, your kneecap doesn't track properly, and that leads to pain. One of the best exercises for building quad strength is the straight leg raise. You lie on your back, bend one knee with your foot flat on the floor, and keep the other leg straight. Tighten the muscles on top of your straight leg and lift it to the height of the bent knee. Hold for a few seconds, then lower slowly. Do 3 sets of 10 to 15 reps. This exercise is gentle enough for most people but incredibly effective at building strength. Your hamstrings matter too. These are the muscles on the back of your thigh, and they work with your quads to stabilize your knee. A simple hamstring curl can do wonders. Stand and hold onto a chair for balance. Bend one knee and bring your heel toward your buttocks. Hold for a few seconds, then lower slowly. Again, 3 sets of 10 to 15 reps. As you get stronger, you can add ankle weights for extra resistance. Don't forget about your hip muscles, especially your glutes. I cannot stress this enough. Weak hip muscles are one of the primary causes of knee pain, and most people have no idea. Your glutes control the position of your thigh, and when they're weak, your thigh rotates inward, which puts stress on your knee. Clamshells are a fantastic exercise for this. Lie on your side with your knees bent and feet together. Keeping your feet touching, lift your top knee as high as you can without rotating your pelvis. Lower slowly. Do 3 sets of 15 to 20 reps on each side. Side leg raises target your hip abductors, which are also crucial for knee stability. Lie on your side with your bottom leg bent for support and your top leg straight. Lift your top leg toward the ceiling. Hold, then lower slowly. You'll feel this on the outside of your hip, and that's exactly where you want to feel it. 3 sets of 15 reps on each side. Now, let's talk about flexibility because tight muscles are a major contributor to knee pain. Your quadriceps, hamstrings, calves, and hip flexors all need to be flexible for your knee to move properly. When these muscles are tight, they pull on your knee joint in ways that create pain and dysfunction. For your quadriceps, stand on one leg, grab your other ankle, and gently pull your heel toward your buttocks. Keep your knees together and your standing leg slightly bent. Hold for 30 seconds, then switch sides. Do this 2 to 3 times on each leg, and do it daily. For your hamstrings, sit on the floor with one leg extended and the other bent with the foot against your inner thigh. Reach toward your extended foot, keeping your back straight. You should feel the stretch along the back of your thigh. Hold for 30 seconds, repeat 2 to 3 times on each leg. Your calves need attention too. Stand facing a wall with one foot forward and one back. Keep your back leg straight with the heel on the ground and bend your front knee. Lean into the wall until you feel a stretch in your back calf. Hold for 30 seconds, then switch. And here's a pro tip. Also do this stretch with your back knee slightly bent to hit a different part of your calf muscle. The soleus, the deeper calf muscle, is often overlooked but just as important. Hip flexor stretches are crucial, especially if you sit a lot. Kneel on one knee with your other foot flat in front of you. Push your hips forward while keeping your back straight. You'll feel this stretch in the front of your hip on the kneeling side. Hold for 30 seconds, then switch. This stretch alone can make a huge difference in your knee pain if you do it consistently. Let me share something that changed everything for me and for countless people I've worked with. Foam rolling. This is a form of self-myofascial release that helps break up adhesions in your muscles and fascia, improving blood flow and flexibility. Get yourself a foam roller and use it on your quads, hamstrings, IT band, and calves. Roll slowly, spending extra time on tender spots. Yes, it can be uncomfortable, but that discomfort means you need it. 5 to 10 minutes of foam rolling before your workout or even on rest days can dramatically reduce knee pain. Your IT band, which runs along the outside of your thigh from your hip to your knee, is often a major source of knee pain. When it's tight, it pulls on your kneecap and can cause lateral knee pain. Foam rolling your IT band can be intense, but it's so worth it. Lie on your side with the foam roller under your outer thigh. Use your arms and opposite leg to roll from your hip to just above your knee. Take your time and breathe through it. Now, let's discuss something that most people completely ignore but is absolutely fundamental to knee health: your movement patterns. You could be doing all the right exercises, but if your movement patterns are poor, you're still going to have problems. When you squat, do your knees cave inward? That's a red flag. Your knees should track over your toes, not collapse inward. When you walk or run, do you overstride, landing hard on your heel way out in front of your body? That sends shock waves up through your knee with every step. You need to become aware of how you move. Practice squatting in front of a mirror. Focus on keeping your knees aligned with your toes. When you're going upstairs, use your glutes to push yourself up, not just your quads. When you're walking, take shorter strides and try to land with your foot closer to your body. These small adjustments can make a massive difference over time. Let's talk about nutrition because what you eat directly affects inflammation in your body, and inflammation is a huge component of knee pain. If you're eating a diet high in processed foods, sugar, and unhealthy fats, you're fueling inflammation. On the other hand, a diet rich in anti-inflammatory foods can actually reduce your pain from the inside out. Omega-3 fatty acids are incredibly powerful anti-inflammatory nutrients, found in fatty fish like salmon, mackerel, and sardines. If you're not a fish person, you can get omega-3s from walnuts, flax seeds, and chia seeds. Aim to include them 3 to 4 times per week. Turmeric is another inflammation-fighting superstar. Its active compound, curcumin, reduces joint pain and inflammation. Ginger is similar to turmeric in its anti-inflammatory properties. Fresh ginger in your tea, smoothies, or cooking can help reduce knee pain. Berries, especially blueberries, strawberries, and cherries, are loaded with antioxidants that fight inflammation. Dark leafy greens are also excellent choices. On the flip side, minimize or avoid refined carbohydrates, trans fats, and excessive alcohol, as they promote inflammation. For some, nightshade vegetables like tomatoes, peppers, and eggplants can trigger inflammation, though this is more individual. Hydration is crucial for joint health. Your cartilage is about 80% water, and dehydration means your joints don't get the lubrication they need. Drink plenty of water daily. A good rule is half your body weight in ounces. For example, if you weigh 160 pounds, aim for 80 ounces. Your sleep quality directly affects knee pain. Lack of quality sleep increases inflammatory chemicals and decreases pain tolerance, making you feel more pain. Your body heals and repairs during deep sleep. Not getting 7 to 9 hours of quality sleep per night sabotages your recovery. Create a sleep routine. Go to bed and wake up at the same time daily. Make your bedroom dark, cool, and quiet, and avoid screens before bed. If pain keeps you awake, try sleeping with a pillow between your knees as a side sleeper, or under them if you sleep on your back, to reduce pressure. Stress management is vital. Chronic stress increases inflammation throughout your body, including your joints, and tenses muscles around your knees, exacerbating pain. Find stress management techniques that work for you, like meditation, yoga, deep breathing, spending time in nature, or talking to a therapist. Make it a priority. Let's discuss some specific therapies that can provide relief for chronic knee pain. Physical therapy is one of the best investments you can make, as a good therapist assesses movement patterns and identifies muscle imbalances. They create customized programs, teaching exercises you can't learn from a video, and holding you accountable. Massage therapy can also be incredibly beneficial, working on muscles around your knee, IT band, quads, hamstrings, and calves. This releases tension, improves blood flow, reduces pain, and enhances range of motion. Acupuncture, used for thousands of years, is now backed by modern research for its effectiveness in knee pain relief. Thin needles are inserted at specific points to promote healing and pain relief, offering an alternative if other methods haven't worked. Understanding heat versus ice therapy is simple. Ice for acute injuries and inflammation. Heat for chronic pain and stiffness. So, if you just injured your knee or it's swollen, use ice. If it's stiff and achy, especially in the morning, use heat. A warm bath, heating pad, or warm towel can loosen tight muscles and improve blood flow. Some people find alternating between heat and ice, known as contrast therapy, works really well for them. Exploring these therapies can significantly improve your quality of life and help manage knee pain effectively. Consider trying a knee brace or sleeve, especially during activities. A compression sleeve can provide support and improve your body's awareness of where your knee is in space. For more serious issues, a hinged brace might be necessary, but always talk to a healthcare provider about what's right for you. Let's talk about supplements that can actually help with knee pain. Glucosamine and chondroitin are two of the most researched supplements for joint health. Collagen supplements, especially type 2, are gaining popularity and have shown evidence to improve knee pain and function. MSM has anti-inflammatory properties, and vitamin D is crucial for bone health. Low levels are linked to increased joint pain. Finally, know when to see a doctor. Seek medical attention if your knee pain is severe, sudden, or if you can't bear weight. Don't be a hero. Some conditions need medical intervention, whether that's medications, injections, or even surgery. Speaking of surgery, let's address that elephant in the room. Sometimes surgery is necessary. If you have a torn ACL, a severe meniscus tear, advanced arthritis, or other structural problems, conservative treatment might not be enough. Arthroscopic surgery can clean up torn cartilage, repair ligaments, or remove loose fragments. Partial or total knee replacement might be needed for severe arthritis. But here's the thing, surgery should generally be a last resort after you've tried everything else, and even if you do need surgery, all the exercises and lifestyle changes we've talked about are crucial for your recovery and preventing future problems. Let me share with you the ultimate game changer that I promised at the beginning. It's something called neuromuscular training, or proprioceptive training. This is training your body to respond correctly to unexpected movements and maintain stability. Most knee injuries happen during quick changes in direction, awkward landings, or unexpected movements, when your muscles don't react fast enough or don't react correctly. Balance exercises are a form of neuromuscular training. Start simple. Stand on one leg for 30 seconds. Sounds easy, right? Try it. It's harder than you think. Once you can do that, close your eyes. Once you master that, stand on an unstable surface like a pillow or balance board. These exercises train the small stabilizing muscles around your knee and improve your body's automatic responses. Plyometric exercises, when you're ready for them, are incredible for building reactive strength. Box jumps, jump squats, and lateral bounds teach your body to absorb and produce force efficiently, which protects your knees during sports and daily activities. But be careful with these. They're advanced, and you need a solid foundation of strength and stability before attempting them. Here's your action plan. Start today, right now. Pick 3 exercises from what I've covered. Maybe a straight leg raise, a clamshell, and a quad stretch. Do those every single day for the next week. Add foam rolling to your routine, just 5 minutes a day. Drink more water. Add 1 anti-inflammatory food to your diet. That's it for week 1. Keep it simple and manageable. Week 2, add another exercise and another stretch. Maybe you add hamstring curls and a calf stretch. Continue what you started in week 1. By week 3, you should have a solid routine of 5 to 6 exercises, 3 to 4 stretches, daily foam rolling, and you're eating better and staying hydrated. Track your progress. Write down your pain level every day on a scale of 1 to 10. Note which activities trigger your pain and which exercises help. Over time, you'll see patterns and you'll see improvement. And that improvement will motivate you to keep going. Be patient with yourself. Knee pain that's been building for months or years isn't going to disappear overnight. But I promise you, if you're consistent with these strategies, you will feel better. Maybe not tomorrow, maybe not next week, but you will improve. The human body is incredibly resilient and has an amazing capacity to heal when you give it what it needs. Remember, your knees have carried you through your entire life. They've taken you to amazing places, helped you achieve incredible things, and supported you through countless moments. They deserve your care and attention. Don't wait until the pain becomes unbearable. Start taking care of your knees today, and they'll take care of you for years to come. So there you have it. Everything you need to know about knee pain, from understanding what causes it to exactly what you need to do to fix it. Now, it's up to you. You have the knowledge. You have the tools. The only question is, will you take action? Your future self, walking pain-free, climbing stairs without hesitation, and living life fully, is counting on the decisions you make today. So, what are you waiting for? Let's get started on your journey to healthy, pain-free knees. You've got this.